Thanks for coming today, everybody. The purpose of today's town hall really is to communicate the most up-to-date information that the Windsor-Essex County Health Unit has on the coronavirus or COVID-19. Sometimes communicating by email can be challenging, so it's nice to do a face-to-face as well. We are going to record this information and make it available. I want to welcome Dr. Ahmed. He's our Medical Officer of Health from the Windsor-Essex County Health Unit, and he's going to be giving us a presentation and giving us the most updated information as of today. So I'll turn it over to Dr. Ahmed.
So thank you very much for inviting me, and I said this before, this is the first time I'm doing it in this format with the echo and this kind of wide audience. So I apologize in advance if you're having any difficulty, but please let me know and I'll try to make myself very clear. So COVID-19 outbreak in China, as many of you know, it's a topic that's been buzzing around everywhere in social media, in the news, people talking about it. And it is important for us to know the facts. And my purpose of this presentation is to give you the facts that we know, and I'll touch on what we don't know. And from a public health standpoint, what we can do to prevent and limit the spread of this disease. So COVID-19 is a disease that is caused by the novel coronavirus. So if you're looking at coronavirus is a large group of family of viruses, and the entire family basically cause some kind of a respiratory illness. Some illnesses happen in the human population, some illnesses happen in the animal population. Very rarely, some of these animal viruses that are common in animal population cross over and get into the human population. When it does, the natural immunity doesn't exist in the human beings for those type of those strains of viruses, and it causes severe infection. So that is exactly what happened in Wuhan, China, when they started investigating a cluster of pneumonia, cases of pneumonia, that are not responding to many of the traditional treatment and without having a diagnosis of what they're dealing with. Upon further investigation, they figured out that it belongs to a coronavirus family, but a coronavirus that no one has seen before. So they initially came up with a naming convention of novel coronavirus to 2019, but as we know more and more, we have a formal name, which is SARS-CoV-2, and the disease that is caused is COVID-19, but generally what you're seeing in the media and everywhere else, it's COVID-19, and that's how it's referred to. So the terms can still be interchangeable in many places, but for this purpose, I'll try to focus on COVID-19. So what is important for this group of our family of viruses, coronavirus, it spreads through person to person in a droplet manner. And just like all the other coronaviruses, it can range from mild infection, which could be a common cold, all the way to more severe infection, leading up to SARS, MERS-CoV, and COVID-19 in this case. What makes it unique for this outbreak is the number of cases. If you're really looking at the number of cases, this is probably the largest outbreak of coronavirus that we have seen in the world. And if you want to compare it with what happened with the previous novel coronaviruses, SARS, which is also caused by the novel coronavirus, infected a little over 8,000 people and killed close to 800 people worldwide. MERS-CoV, which is the Middle Eastern Respiratory Syndrome, also caused by a coronavirus, infected close to 2,500 people and killed a little over 850 people worldwide. COVID-19 has so far infected a total of 110,000, and again, this number is constantly changing. I updated this number last Sunday night, so this number is accurate as of Sunday night, which is March 8th, I believe. And 3,825 deaths, but just this morning when I was checking in, it passed 4,000 death mark. And again, so in any parameters, if you're looking whether the number of cases or number of people dying, it has exceeded those potential. And that is why the entire public health world is trying to get a good handle of it, trying to make sure that we have implemented measures to control and contain this virus before it kills more people. When the virus initially started infecting people, majority of the cases were centered around a city called Wuhan in China, and then spread towards in the whole province of Hubei, and then spread to everywhere. When maybe not more than 2 weeks ago, when I was doing this presentation, 98% of these cases were in China. But the number is now changed. 73% of these cases are in China as of Sunday. That means there's a significant majority of cases now happening outside of China, which points to the fact that it is going towards a pandemic type situation where more and more countries are added to the list. And right now there are more than 100 countries outside of China that has a confirmed case of COVID-19. What is happening locally is in Canada, and again, as of Sunday, there were 62 cases. I think it's gone up to 71 cases right now, and the numbers continuously changing. So please, I'm just putting this disclaimer out, don't quote on these numbers because the numbers are constantly changing. What is important is the number of cases in Ontario. So as of this morning, I think there was 34 cases in Ontario, but no case in Windsor and Essex. You can see I have mentioned that there's a long-term care outbreak in British Columbia and no death. So please scratch that. There is one death that was recorded in British Columbia. That was yesterday. And that is also one of the things that the situation is evolving so quickly that it's hard to even keep up with all the information. So the number of cases that are affecting outside of China, obviously there's more than 100 countries now have confirmed cases, but some of the countries are seeing more cases than the other. And again, all these numbers are not accurate, but the key country that are showing most of the activity is the top three: South Korea, Iran, and Italy. So those are the three countries that are seeing most of the cases right now, with number of deaths increasing in all of those countries, and the number of cases are increasing there as well. There's a reason that I put in these 5 countries because if you go to the Public Health Agency of Canada website, these are the countries that is identified as the list of impacted country. But again, maybe they need to update that. As of now, we are just going with that number. We live in a border town, so obviously USA is important because of our travel. We have more than 547 cases now and 21 deaths in US. So situation in Windsor and Essex, no confirmed case of COVID-19, but it's not to say that nothing is happening locally. There's a lot of people who are currently being tested for COVID-19 for the presence of this novel coronavirus, and so far all of them are negative. I want to say we have tested more than 20 people, but again, those numbers are keeping adding up. All of those came back negative for COVID-19, but still a majority of them came back positive for influenza. And I think that's a critical piece of information when we are looking at it, because most of these respiratory viruses, they behave exactly in the same way, they spread exactly in the same way, and most importantly, a virus or an organism has to be present in the community, in the atmosphere for it to spread. If it's not there, it won't spread. Same thing, if COVID-19 is not here, it won't spread. But what is here is influenza, and we have those cases. So all the measures that you're thinking about taking for COVID-19, you should be considering about influenza, which is also here. So from a public health standpoint of view, we obviously are interested in people who are returning from these countries. And the way we have classified is there's a high-risk travelers, there's a medium-risk travelers, and a low-risk travelers. So high-risk travelers is anyone who has traveled to the province of Hubei that was the epicenter of this outbreak. And also Iran was there in the list too. If they have traveled and returned in the last 14 days, they are considered as high risk because of increased transmission, local transmission in that community. So there's a strong possibility that they may have the virus. So the advice for them is to self-isolate. So that's the only group we're asking them to self-isolate. You should not go to work or to school or to anywhere until you pass this 14 days period. And during that self-isolation, we're asking them to self-monitor, to report back to public health if they have any symptoms. So our staff connects with each of the people who are under isolation, and there are people who are under isolation. We connect with them, we make sure that they're doing okay, they do not have any symptoms, and the symptoms includes any acute upper respiratory infection symptoms, which is new onset of fever, new onset of cough, any difficulty in breathing. These are almost similar to many of the others in a respiratory infection, whether it's influenza, whether it's common cold, so it's hard to differentiate. Once you are symptomatic, and if you have a travel history, then yes, we are interested in you to test you. And again, the number of countries that are in the list, it's constantly changing. So it's our advice is, if anyone who is coming back from these affected countries, or any country where there is active cases of COVID-19, contact us. Even the healthcare providers, we are asking them, contact us, and we'll help you walk through and do the risk assessment, whether this person needs to be tested, whether any additional measures are needed or not. So we make that recommendation. And then you have medium risk travelers who didn't travel to those places, but travel to anywhere where there is cases of COVID-19. So this is all based on the guidance document that was produced and updated by the ministry. And again, this is a constant process as well. Every day we are getting an updated document. But just to give you an idea, so the high-risk travelers from a public health standpoint, without identifying where the names are, would be focused on the countries where there is increased local transmission. And medium risk countries are presence of COVID-19, but not a strong evidence of local transmission. And then the low risk travelers are any traveler that is coming from countries that are not impacted by COVID-19. So the list, again, it's constantly changing. So it's just there to help us guide, but our advice is to connect with us, for the healthcare providers, for anyone who's looking for information, for us to triage and make that determination. So this case definition was last updated on February 28th by Public Health Agency of Canada, and this include any person under investigation. So a person with a fever, new onset of cough, or difficulty breathing, so they have to have some kind of symptoms. So symptoms are critical, and then when that part is met, then we move on to the travel piece, so where they're coming from. If they're travel to mainland China, or the areas where there is increased transmission happening locally, and they have arrived within the 14 days mark. So 14 days, again, it's a little bit of a stretch which public health uses to capture anything and everything. But what we know for this COVID-19, the incubation period is typically around 6 to 10 days. So within 6 to 10 days, you should have some symptoms. And if you're past, most likely you won't, but 14 days it's a more conservative measure to make sure that we are not missing anything out. So in addition to travel, if you have come across with a confirmed case of COVID-19, then you may be at risk. If you come in contact with a person, close contact, and again, close contacts are generally family members, who has traveled to an affected area in the last 14 days, and the affected area list is right there. If they're coming back, you may be at risk. But for anyone who hasn't gone anywhere and who hasn't come in contact with anyone, the likelihood of them having COVID-19 is pretty much none. So from a local response perspective, obviously it has gained more traction now, but we have been working on this for more than 2 months now. As soon as we became aware of what's happening in China, we pulled together a team locally, bringing in all the acute care hospital system. We brought EMS together. We looped in some of our primary care providers, and to start having that dialogue. What does it look like if we have a case of COVID-19 in our community? What our response should be? And recognizing that there's a lot of misinformation, so we needed more collaboration, cooperation with each agency so that we are all playing with the same songbook. And the flow of information is also critical, because what we are saying, what the hospital is saying, what someone else is saying, we should all be using the same protocol as much as possible. So we pulled together all those people, we came up with our plan, and that conversation is happening every week. So every week we are meeting, we're talking about some of the challenges and discussing some of those plans. And the other critical piece is the misinformation piece. So we realized that there's a lot of information. Obviously, when SARS happened, there was no social media. But right now, there is social media, and social media sometimes can be a good thing and sometimes can be a bad thing. A lot of information is flowing out. Some of them are true. Majority of them are not true. So we felt that it is important for the general public to have access to credible information. So we are asking people to go to our website. That's www.vichu.org/coronavirus. If you type in, it will take you to our main webpage, which looks like this, and it has all the up-to-date information from a local standpoint. It has resources for the primary care providers, for the healthcare providers, for general public, and we also have a section of FAQ, which we are populating based on the question that we're receiving from the community. We have a dedicated hotline for people to call us if they have any questions or concerns about COVID-19, and then we are also connecting with the healthcare provider through that line as well. So all of that information is on our website, and people can go to our website to get that information. So when faced with this type of infectious diseases outbreak, so the public health approach, as trivial it may sound, it doesn't change a lot, because what we go through is how is this disease spreading, what can we do to control the spread of this disease, and then what are the treatment and what are the possibilities of having a vaccine. So that's the typical approach that we take when we are faced with any type of infectious disease. So in this case, if we have the disease, which is the novel coronavirus, in an ideal world, we like to eradicate this virus from the face of this planet, which unfortunately doesn't happen, but that's the ideal goal. And obviously it's not working, but the key part is the virus needs a human reservoir. It cannot survive long in the environment. It can survive for a few hours. We don't know exactly how long it can survive, but typically most of these viruses, we use a marker of between 2 to 8 hours. After that, most likely the virus is unable to survive in that environment. So it needs a human reservoir, and when it found a human reservoir, a host, what the approach is, the virus is in that person. If we can't kill it, if we cannot control it, what we need to do is isolate that individual so that this virus doesn't leave this body. So that's the goal of public health, that when we're asking, okay, self-isolate, you do not go out in the public, and you need to stay out of contact with anyone else that are in close proximity to you. But let's say, and in that case, the key decision point for public health is how quickly we can diagnose it. Because the moment we can diagnose someone, it would be very easy for us to isolate that individual and put them into some kind of a containment mode where this person is unable to spread it. So because we don't have any case, our main effort working within the healthcare system is early diagnosis and isolation. So that's what we are working on right now. And let's say if that fails, the virus needs to come outside of the body of that host and then find new host. And that happens is if a person is coughing and sneezing, we ask them, cough it in your sleeves, don't cough it on other people, and use mask. So mask, what we are saying is mask is useful for someone who is symptomatic, and it's to protect others, not them. But what is happening is there's a rush for people who are buying masks thinking that if I'm wearing the mask, I can protect myself. Well, you don't even need the mask. The mask is important for people who are sick, and they are using it to protect others. So when it's exiting, the mask helps to prevent that spread. And let's say if that mask is not there, if this person is not following that, then it requires some kind of a mode of transmission. So the common mode of transmission is handshake, touching some of the most common places like door handle, doorknobs, even microphone or this clicker, anything that most people touch, that's where it is transmitted, because the virus can survive on the surfaces between 2 to 8 hours. So all those, the high touch surfaces need to be cleaned appropriately with the right cleaning agent to make sure that we are getting rid of all those viruses from there. And if that fails, what happens is if I'm touching something, I have to introduce this virus inside my body. If I'm washing my hands, which we should all many times a day, especially in the flu season or the respiratory viruses season, if I'm doing that often, even if I'm touching something, I am not bringing that virus inside my body. So the moment I do some of that, I'm washing my hands either with warm water and soap or using alcohol-based hand sanitizers. If I'm doing that, I'm getting rid of that virus from my hands. And then let's say if it all fails, having a virus in my hand doesn't mean that I'm infected. I still have to bring it in. So touching your mouth, nose, or eyes, those are the portal of entry for this virus. Any mucous membrane that is moist, so it gains entry into the system. So that's the other recommendation. So even hand washing and not touching your mouth, nose, or eyes frequently. I know all of us do that intentionally, but this is something that we need to be mindful, and we need to be reminding ourselves that we shouldn't be doing that. And if that fails, then obviously the virus is inside the body. And then if the virus is inside the body, what we are looking for is there a vaccine? Because if there's a vaccine, that means the body has the immunity to fight off this virus. But unfortunately, we don't have any vaccines for COVID-19 at this point. For influenza, yes, we do. So that's the other thing, that when you're comparing what you can do with some of these measures is thinking about what is available and what's not. So there is no vaccine. Now the virus has gained access to the body and now making the body sick with all those symptoms. And most of the individuals, if you're looking at this case numbers, most of the individuals that are infected with COVID-19, they will eventually get better. Yeah, the number 4,000 deaths is alarming, but influenza already killed 1,500 cases in Canada because of influenza. But we don't talk about it. But we are talking about COVID-19, yes, because it's a novel infection. Nobody has seen this infection before. So not to undermine the potential for this disease to cause more death, but just to give you some perspective that it is there, majority of the people. So based on some estimate, they have calculated the fatality rate to be somewhere between 2 and 3 overall in the world. Some places are seeing more case fatality rate, or up to 4% in Italy or 4 to 5% in Italy. But the general message is it's not something that if someone is infected, it's all going to be bad. Majority of them will be fine and they will recover. People who are not recovering, or people who are dying more, are the sick and elderly. The elderly population over the age of 60 with some kind of a comorbidity, those are the individuals that are included in the list of people who are dying. General healthy public, they are generally safe. Not saying that no one has died in that age group under 60, people have, but those are the rare individuals. But majority of the cases, they have some kind of comorbid illness. And then what we're talking about is if there's any treatment. So unfortunately, there is no definite antiviral treatment at this stage for COVID-19. And all the pharmaceutical companies are now rushing to get some kind of a treatment for COVID-19, develop a vaccine for COVID-19, because whoever comes up first, they'll probably be making lots of money. And as of now, there are some of these drugs that are being trialed, but there is no approved treatment from any credible agency at this point that use this for the treatment of COVID-19. And then, because there is no antiviral treatment, the cycle goes on, people are spreading, and then it's just contracting, and then the cycle continues. And that's what we are seeing around the world. So again, the public health message at this point is there are a number of steps that you can take at the individual level, even when we don't have the vaccine, even when we don't have the antiviral treatment, that can protect you from contracting COVID or also spreading COVID. So the advice is, if you're sick, stay home. And if you're concerned about COVID-19, call us, and then we'll help you figure it out whether you need some additional testing or if you need to do something different. So stay home, and then the next step is, if you're coughing and sneezing, making sure you're not doing that in front of other people, coughing and sneezing in your elbows, and maybe just cleaning your nose more frequently. Hand washing is another critical piece, as trivial as it sounds, but it is probably the most important thing that you can do to protect yourself from contracting many of these viruses. Hand washing, proper way of hand washing, 15 to 20 seconds of contact with soap and water or alcohol-based hand sanitizer, making sure that you're rubbing the soap and alcohol-based sanitizer to all areas of your hand, especially in the palm, especially between the webs of your finger, and do that for 15 to 20 seconds, and that would help to get rid of the germs that is in your hand. It's just a quick hand wash with the soap, it's not gonna do it. So making sure that you are doing it appropriately. So all of these measures, including not to touch your eyes, nose, and mucous and mouth, would protect you from contracting COVID-19 in the first place. So if we are taking that as individual responsibilities, then we are playing a part in reducing the spread of this transmission. So I'll stop at this point, and I don't know if you want to invite questions at this stage.
Earlier in your presentation, you mentioned you had a slide up there about Ontario, 34, but I think you said it's around 40. What part of Ontario is it hitting, or the people that have the cases right now?
So most of the cases are in the GTA area, Toronto, York, Brampton, and I think Mississauga was also included there as well. So all of the GTA, that's where the cases lie, like majority of them. And then we had the odd one in London too.
Thank you.
Any questions right now?
All right. So that's good. All right. Okay, so thank you very much, and I hope that this was useful for all of you. Right.
All right, thank you, Dr. Ahmed. I appreciate you taking the time out of your very busy schedule to come and talk to all of us. We are going to make this available to everybody. A couple of things to note. Communication updates will continue as we get more information, and we will send them by email and also post them on our website, St. Clair College, under Student Services, under Health Center. That's where we're posting all of this information. So please continue to monitor that site, but we will also send out updates through email as we get them. Also, in light of the March break coming up, we are asking people to complete a travel questionnaire. It is on the same website I just spoke of, and basically it's just asking you your travel date and where you're traveling to and from. The health center will retain that information. We are not going to spread that information to anyone. The health center will hold it in the event that they need to disclose that to public health. So that's the added step that we're asking students and staff to take. It is one form for both students and staff to complete. At this time, I just want to say thank you. Are there any other questions? As we get into, if there's any further instructions, like I said, we will definitely give those to you through email. And we will work with academics for the students and with HR for the staff and provide more information as it comes up. Are there any further questions? Elise?
Rebecca, I just wanted to remind everybody that we are still giving flu vaccines from our health center. So, as Dr. Ahmed said, there are many, many, many more deaths from influenza here in Ontario than we would ever expect and hope for COVID. So please, if you have not gotten your flu vaccine, come and get it. It's a way of preventing possible death for you, and make sure that your family members are protected too.
Thanks, Elise. That's a very important point. The other point that Elise just reminded me of is if you are concerned that you could have coronavirus, please call. Don't come into the hospital. Don't go to the, unless you're obviously sick and you call EMS, but please call ahead. We can do a screening by telephone, and public health can do a screening by telephone and advise you whether or not you should attend a health clinic or not. We are not set up at the health center to do the testing, but they will be able to advise you where to go to do that testing. So please call ahead to advise them of your concerns. Wayne? Dr. Ahmed, are you still? Dr. Ahmed, the question was, are you open 24/7, or can they call you during the evening or on the weekends?
We are available for healthcare providers 24/7. So we have an on-call person who can take that, but generally speaking, unless you're really, really sick, if you are, then probably you need to call 911 because there may be other thing that's bothering you. And if the concern is only about COVID-19, I think the better option is to call us during the business hours, and we'll try to get to you as soon as possible.
Thank you. Question? Sorry, can you use the microphone, Mike? Yeah.
Sure. Is there any estimate for how long they predict this will take to contain? Would it be 6 months, a year, or could it just keep going?
Very good question, and we were just talking about that as well. How long it will take to contain this. Usually in this type of pandemic, you need all hands on deck, and you should be doing all of those measures. When it's spread up after a certain threshold, it's difficult to contain it, which is exactly what we are seeing right now, until we get to the point of having some kind of a vaccine available, or quarantining probably the whole country, which now is being tried in Italy as of this morning, that they've pretty much restricted everything out of Italy. It's very difficult to contain. So what we will see is, with all these measures, is we are basically reducing the number of people that may be impacted by it. And then that's the message. The more strong we are with the messages in terms of protecting and reducing those transmission through all of the measures that I just mentioned, it would be difficult to contain. The prediction for most of this, if you see from the researchers and scientists, the numbers will keep on increasing, and until we get to the point that every country is taking the right measures, people are changing their behaviors, it'll be very difficult to control. I don't know if I answered, but that's the best I can.
Are there any other questions? All right, thank you. And if they are, feel free to communicate that to us, and we can certainly try to get the answers for you and post them as well. Thanks, everybody, for coming. I appreciate your time.